Hello and welcome. My name is Lorraine. I'm so pleased to be joined today by my nursing colleague from across the pond. This is Mary Hesdorffer.
Hello, Lorraine. Thank you so much for inviting me to be with you today. We've shared many occasions together. We've participated in conferences together, and the two organizations have had a very strong relationship for many years. And we sort of mirror a lot of the work that's done in this patient population and serving the families affected by mesothelioma.
It's a pleasure to speak to you, and I'm so grateful to you for giving up your time today. I always talk about us as being sort of like sister organisations. Would you like to tell people a little bit about the Mesothelioma Applied Research Fund?
Absolutely.
Foundation.
So the foundation, right. So it's the foundation. It started over 20 years ago. And the mission of the foundation is to spur mesothelioma research. And we do that by our own peer-reviewed funded mesothelioma research program, in addition to advocating on the Hill and through the Department of Defense, trying to get governmental funds also to fund mesothelioma research. As you know, we only have one approved regimen, approved in 2003. So research is so important to move this, to move the ball forward. In addition to funding research, we have a travel grant program, and that helps us to assist patients to get to see specialists. And also, if patients are interested in a clinical trial, we're able to provide transportation assistance for people who are traveling. The United States, the travel can be great distances to get to a specialist, so we realized there was a need. We have many supportive care initiatives where we have Facebook groups for support. We have telephone support groups. We also have enlisted the help of psychologists and psychiatrists to help with some of the support groups, recognizing that during COVID, the needs of the patients and the families are so much greater. We do educational seminars. We hold symposiums. In years where we're, virus free, we've held a yearly symposium bringing together experts in the disease as well as the patients and families. And I know you've attended some of our conferences, and I've attended some of yours. Yeah. And we're a staff actually of 4. So we've got a large mission, a small staff, and everyone works really hard to meet the needs of this community.
Great memories and great learning environments and sharing, getting to the nitty-gritty of what we're feeling and how we can help people. How would you describe the feeling amongst mesothelioma patients now?
Right. So, it's difficult to talk for the patient because I'm not walking in their shoes. But, from my perspective and what I'm observing, it's a very difficult time for patients. As we spoke about, the distance in the United States are, large. To get to a specialist, patients can have to travel sometimes 5, 6, or 7 hours. There's that fear of getting on a flight, fear that many of our centers are located in cities where they have high prevalence of COVID. There's also, that the problem, as you've experienced as well, where some patients have not been able to complete their trials, particularly those that have a maintenance arm because of the risk, versus benefit ratio. Something that I fear, and I presume the patients fear as well, to make progress in the disease, not only do we have to do the initial research, but then this research has to translate to a clinic. Patients need to be enrolled in these clinical trials so we understand whether drugs work. And I think the great fear of many of us is that, this virus, the lack of patients being able to participate in clinical trials, et cetera, will really have an impact on, getting new drugs to market. So, it's a frightening time for the patient and family community.
We've run a number of surveys in the UK, both Mesothelioma UK and also an umbrella charity called Cancer 52. And it's really looked at how patients felt and their families as treatment and clinical trials were paused or halted or finished as a safety measure, and really difficult times for people.
Yeah, and as you know, for yourself and for what's happening in the States, my role, a big piece of what I do is really to guide patients and to help them make some of these difficult decisions and to identify clinical trials that they may be eligible for. And right now, it's a moving target. Clinical trials are opening and closing, put on pause, they're reopened. We're watching a resurgence of the virus in some areas. So where we were starting to open up, perhaps we're beginning to close down. Some of the big surgeries where they're worried about the requirements for blood banks are low. So, there's an impact from so many different, areas in this disease. And for me, to really be able to guide the patients, it means that it's a constant phone calling back and forth with all the specialists. Are you open? What is available? How quickly can they get on a trial? Some of the institutions now require that, if a patient is being considered for a trial, it's not just the eligibility criteria today, it's risk versus benefits in light of COVID. And a committee is actually sort of sometimes helping to make that decision whether or not certain trials can be offered to patients. So it's very tricky, very complicated, a complex situation, difficult to navigate. And there's no real clearinghouse that has that kind of up-to-date information. So it really requires, this constant outreach from the foundation to the various clinicians and researchers and keeping, our eye on this moving target.
And we're so used to giving the information out to patients, aren't we? And now we have to keep on check and balance about, for you, I presume, whether it's moving forward in one institution where it's just been paused in another because of COVID affecting different parts of the States. So it really is a logistical nightmare in some ways, bringing that information together.
It is, and oftentimes too, with mesothelioma patients, we do have some trials now that are further along, phase 2 trials, but there are patients who don't meet the criteria. So then there's to search for those phase 1 studies. And to bring a patient across the country for a phase 1 study, it's a difficult decision. So I'm concentrating on looking at regional centers to see, what clinical trials they have. They may not be designated for mesothelioma per se, but perhaps they have a target that's attractive for mesothelioma, that I can at least say, there's a rationale for trying this in mesothelioma, even though it may not be a mesothelioma specific trial, rather than tell patients, we're halting everything and I don't have a treatment for you.
If we took one step before that on diagnosis, what's your feeling about people not presenting with the signs and symptoms because of the fear of the pandemic?
Right. So, I think, as always with mesothelioma, the symptoms of meso just, mimic so many other diseases. You see people who have signs of congestive heart failure, pleurisy, pneumonia. Other cancers certainly have very similar symptoms. And now you look at COVID-19, which is a respiratory disease. So, you have these respiratory symptoms. There is a lot of confusion in trying to get patients for a diagnostic workup because it starts with primary care and primary care to a pulmonologist. And though, we are encouraging people, if they have symptoms, to get to a doctor, to get to a hospital to be diagnosed, there is that fear. When all is said and done, I presume that especially in a country like the UK, where you have a nationalized medical plan, you'll be able to look back on this data a little easier than we will, because we'll be pulling it from all sources and trying to really run those numbers and understand the impact.
Mm-hmm. What we've tried to establish, once patients have been referred on, and also those who are going back for treatment or re-establishing regimes, to reassure them that they are actually going into COVID negative environments, which has been difficult because people are instilled with the fear. We've learned that some people patients with mesothelioma are as concerned about contracting COVID-19 as they are about their cancer. So it's like a double-edged sword coming at them, really.
Correct. And I think, particularly in the UK, where, if you have access to a vehicle, you certainly can drive to appointments, easier than you can in the United States. Here, so many of this depends on rail or plane travel, and people are, and it's correct. I mean, it is a frightening time right now for air travel.
Mm-hmm.
What is that risk that you're taking?
Mm-hmm. And how do you think that the thoracic oncology workforce has adapted to how it has had to adapt?
Right. So, so I've spoken to, many of my colleagues, and, they're able to, review, slides, review the scans, meet with patients by phone, recommend treatments, etc. And that can work out in a patient's favor, actually, if you're seeking second opinions, because you may have greater access to a number of physicians and get them by phone, and it's less travel time. The real difficulty, from what I'm hearing, is how do you have those heart-to-heart conversations? How do you tell someone that the treatment is no longer working? Or how do you transition to hospice without, being able to put your hand on a patient's shoulder, look them in the eye, watch their body language, pick up the signals to how they're absorbing the information? And I think it's hurtful for all sides. It's very sad as a clinician not to have that physical presence. And for the patient, I think, the telephone is one thing, a video is one thing, but I think establishing a really trusting relationship does take those in-person visits.
Mm-hmm. And often it's having the loved one by the side, isn't it, to hold the hand or guide them through. We've been in a situation where there has been no visitors allowed into hospitals. I'm not sure about in the USA. So people have received this dreadful news and not been able to talk to the loved ones about it, other than on the phone or via, Skype or a video. So that's been tremendous as well. And when people have been transferred to hospice, if they've been so poorly, again, they've got to the hospice where normally visiting would be really open, the environment would be completely different. And through no fault of their own, hospices have become quite lonely to people because they've not been able to have the open visiting that they would have had.
Right. So in the United States, it's a small percentage of patients that actually go into a hospital-type hospice setting. Most patients, if they're referred to hospice, are referred to at-home hospice.
Right.
But, I think also, in terms of the difficult conversations as a nurse, one of our main functions really is to interpret, to reinterpret, to try to tease out what was actually said in the exam room and to help patients understand it. And, usually when you have a number of family members, everyone is using a keen ear to hear what's being said. And there's an interpretation that takes place, because we bring our own prejudice, into any type of a discussion. So when you only have one-on-one discussions, sometimes there is information that gets lost or misinterpreted. And stress, certainly stress, chemo brain, all of that, figures in when you're trying to have these type of difficult conversations via video chat.
It's how the family becomes a skilled helper, or the loved one becomes a skilled helper in many ways, because they've heard the same sort of situation, they've heard the explanation, but they may interpret it differently. And so sometimes the patient may then try to hold things in a little because they don't want to go through all that again with a loved one who's missed out on it. So dynamics have been really difficult, haven't they?
Correct. Yes, absolutely. You
Mhm.
know, and I mean, you know, I just look at it sort of an anecdotal experience. I'll have a patient that will be asking about, you know, their ADLs, their daily living activities, et cetera. And how are you sleeping? I'm sleeping well. And you'll turn to the caregiver, how are you sleeping? And you'll find out that she's been up on and off all night with the patient.
Mm.
So, you know, it really takes that dynamic to sort of tease out what's happening in the home. People don't want to sometimes be seen as quote unquote complainers, though we wouldn't label them as a complainer. What we're looking at is to tease out that information that's important to make clinical decisions. And sometimes people feel like they have to present themselves in the best possible light to be liked.
Mm-hmm.
And, you know, you and I both know we like you, we love you, no matter how, you know, how you present in this exam room. We're here for you.
And to be fit, sometimes, you know, they just want to be seen as being fit for treatment, don't they? Which very often they are, and obviously it's up to us to sort out the performance status and have a, but you need that discussion, sometimes you say, from both the carer and the patient to actually make it a little bit of a firmer decision when you think about taking the treatment forward.
Exactly. And, you know, I've been running some new support groups. I just recently ran a support group for adult children, you know, because they're not the primary caregivers. They're helping to make some of these treatment decisions. And often because of COVID, they cannot be at their parents' side. So it's a very difficult time as, you know, I don't want to call them a child, an adult child. And conversely, parents, you know, we are seeing younger mesothelioma patients. And, you know, the parents are used to being very involved in their 20 and even 30-year-olds' lives in terms of their medical appointments for the meso, and they're not able to be with them.
Mm-hmm. Mm-hmm. And then, of course, we've got the environmental factors of mesothelioma and occupational factors. Often through to our information line, we get queries from adult children, just asking those questions, really. So I think the idea of your support group, for presuming that's been virtual, has it? The support group for
Yes, yeah. It's
adult
actually, yeah, it's virtual. And, you know, I think also what I've seen over the years and what really has prompted me to, you know, try to get this new support group up and running is so oftentimes, you know, it's the adult children become that driving force in treatment making decisions and what clinical trials and what, you know, specialists to see. And, you know, unfortunately, in many cases, you know, patients do not always are not always successful in this disease, and these adult children are left with terrible feelings of guilt. So if we can provide more support to them as they're helping make their parents make their decisions, perhaps they won't be as haunted by the what if, I could have, I should have, but they feel that they're bolstered and they're made to understand that you're making the best decision possible with the information we have at hand today.
That's
And I
really
think that's something that we really have to reach out, and because many people are hurting. Many people are really suffering, those left behind as well as those currently in the battle.
That's really interesting, you know, really food for thought for us across here. Do you think there's anything we've learned, anything that's good that we can bring out of experiencing the pandemic for patients with mesothelioma?
Anything good?
Dig deep now, Mary.
Yeah, I'm trying to dig it out from a patient perspective.
But for us, I
You
suppose what
know,
I'm getting at is that, and we may be different to you because of the vast different distances that
right.
patients travel, but some people have liked the telephone consultations or a video consultation. We may just be an island here, but some people do travel long times, not compared to you, but long distances to clinics where sometimes it can be just a quick consultation. And I think some of them are feeling that video consultations may help in some situations, say if it's just for the result of a scan and the scan's a good result, so that sort of thing.
Right. So in terms of video conferencing, I think as I had mentioned before is, I think the benefit, there is the one benefit I see is that you're able to get second and even third opinions with specialists who are not in your locale that you don't have to travel to. So I do see that as a benefit. You know, the other benefits, I just don't know that I see many benefits right now at this time for patients. I think it's just this terrible burden has been put on everyone, and you know, it's a very, very difficult time to be sick in this world.
We're just coming out of what we've called shielding over here for those
Mhm.
extremely vulnerable patients of all cancers and other health conditions. We're just pausing shielding, is that what we're calling it here in the UK, apart from those areas, because we have got areas regions which are going back into lockdown because their numbers of COVID-19 patients are rising in various areas across the UK.
Mhm.
So have you had shielding in that vein? Have you advised a whole host of people to stay at home if they are extremely vulnerable?
The video has paused a bit.
You're back together with me now.
Yes, the video had paused. Mhm.
Yeah. Did you get what I was saying there at all?
I didn't.
No, sorry.
Something about shielding, and then they were beginning to come out from under the shield.
Yeah, and that can still be a scary place for people to be in because they've adhered to what they've been told to do, and now they can go out a little bit more, or they can mix with more people. Obviously, we're advising them to be extremely careful. Is that the same in the States?
Yeah, so we didn't really have any shielding. I mean, that wasn't a term that was used. And I know that you know, they reached out through the UK to the health services to patients who were vulnerable. That same reach out did not take place in the United States. We don't have that sort of a centralized authority for that. So I can say that, you know, some states are beginning to open up a little bit. And, you know, right now, you know, we have good weather. So it certainly makes a difference that, you know, people can meet, you know, outside with a mask. And, you know, I've gotten together with some of my friends, you know, seating, you know, far apart, you know, using that 6 foot distance and with masks and being able to chat and to share some time. So I think right now that's wonderful. And, you know, I think in terms of, you know, really coming out of all of this, I think, you know, we're still waiting for an effective vaccine and, you know, and treatment to know that, you know, people who are vulnerable can really get back out. I think, you know, cancer patients in particular, you know, I'm looking at some of the clinical trials right now for vaccines, and, you know, they're being offered, they're placebo controlled, most of them. They're being offered to a young population to start. So it may be a while before we see vaccines being offered to the more vulnerable. You know, I don't know how this will line up yet. You know, they still need to go through a lot of safety testing. So I think everyone has to err on the side of caution until we're sure that we have the numbers under control and we don't start to see flare-ups. You know, going back to school now is a very contentious issue in the United States. Very differing opinions about whether it's safe to bring the children back to school. And, you know, what does that add in terms of a layer of complexity for our older mesothelioma patients in terms of visiting with their grandchildren, or perhaps having been the helper as a, you know, as a secondary caregiver while their parents worked. So, you know, that's another area that I think, you know, we're going to need to just really keep a sharp eye on.
Yeah. And I think the effects of the pandemic going forward will have a great effect on people's mental health, particularly those with conditions like mesothelioma. So we've got a lot of hurdles and obstacles to overcome, haven't we?
We do. But, you know, as you know, and I know that, you know, the psychiatrists and psychologists and social workers and counselors, you know, are doing these telemed visits. And, you know, I think it's always, you know, particularly in older patients, sometimes they feel that depression is a sign of weakness or a mental deficit. rather than, you know, none of us were born to cope with a disease like this. It's really hard to find those coping mechanisms, and, you know, working with a specialist can help you identify better ways to cope with mesothelioma and to live with the disease rather than as the disease.
I'm sure at MARF and also at Miso UK, we're really encouraging people to speak out and let the difficulties be known. I think that's very important. What's been the effect on MARF? What has it done to your organisation?
Well, you know, from the organization itself, I'd say, you know, in response to COVID, we've had to activate a few new programs. You know, we've had to adjust the way we work. Certainly, the office has been closed. We now have staff members that go in once a week to process the mail, but we're working from home. We've instituted these new guided sessions with psychiatrists and psychologists because I felt that, you know, we needed that extra layer. Our board has gotten very, very, very much involved in trying to help us get access to all the information we need to work with family members. So, I mean, that's, you know, that's been the impact. And certainly, you know, we've relied a lot on fundraising as you have, and having lost that ability to have those in-person fundraising events, hold our conferences, you know, all of that certainly has had a financial impact. And, you know, I don't want that impact to translate to patient services or to the much necessary research. So, you know, we have, you know, we've trimmed the budget down to the smallest we could have, and we're actively soliciting funds and, you know, trying to give our sponsors value for their donors, for their donations.
Brilliant. I've enjoyed watching some of the movies, some of the MARF movies that we can link to from your website, which have been very interesting, bringing collaborations of clinicians and patients from both sides of the pond together. So they've been really interesting. Trying to get your message.
Yeah, so that's our Miso TV. That's what
our Miso TV. Yeah. Good. It's a
we can't. We're not going to reach the level of those novellas, but. But I think, you know, I think it's a good way. It's a good way to connect. You know, it gives people a chance to turn off the news, get away from COVID, and to sort of feel that, you know, they're in the know. And so many have attended so many of the conferences. They see familiar faces, and I think that, you know, feeling of familiarity also helps. And that, you know, that there's smart people interested in your disease, I think helps greatly.
Yeah.
You know, when they can see that the doctors also are struggling, but they're determined to do the best for their patients, I think, you know, that there's comfort in that.
Yeah, I think you've hit the nail on the head there, Mary, with our light views. Thank you so much for speaking to me today. It's always great to speak to you. I wish you well, and I hope everything goes well at MARF, and that we can meet together before too much longer. But I think it's going to be time off at the moment.
And thank you, and please send my warmest regards to all my nursing colleagues in the UK. I mean, we've, you know, I've always looked forward to those times where we've all been together. And I miss you all terribly. You do such a tremendous work in the UK. For those who have had the opportunity to work with Miso UK nurses, it's extraordinary. I mean, the dedication, the expertise, and the support that they give to the patients, and the supportiveness to myself and other nurses has been just tremendous. So keep up the good work, Lorraine, and congratulations on, you know, the promotion in your new role as well. Very happy to see that. Thank you. Take care.
Bye bye.
You too. Bye.